Good evening and welcome to 6:30 Central. I'm Craig O'Neill and here are some of the stories we're bringing you tonight. A family is sharing their COVID-19 story ahead of the holidays, why they're urging people not to gather. Plus, the Thanksgiving travel season has begun despite the ongoing pandemic, and that has health experts worried. And some families are in for a long and uncomfortable Thanksgiving dinner after a very divisive election. A few things to keep in mind before going to dinner angry. But first, Dawn Scott is live with the latest on Arkansas's COVID-19 findings.
Well, good evening to you, Craig, and to all of you at home. You know, we're just 3 days away from Thanksgiving, and Arkansas's COVID-19 hospitalizations continue to climb in our state. Right now, 974 people are fighting this virus from the hospital. That is, once again, a new record. And Governor Asa Hutchinson says how we handle Thanksgiving will determine what that number looks like around Christmas. Here's a look at the number of beds in the state compared to how many are currently being used for both COVID and non-COVID patients. Of the 9,144 beds in Arkansas, 2,530 are still available. But it's the ICU beds that really have health officials concerned. The state has 1,136 beds in hospitals across the state. Right now, only 76 are available. As for new cases, another 1,017 added to the state's total active number of cases today, and 30 more deaths were reported in the last 24 hours. That brings the state's death toll to 2,387. Nationally, just over 3 million Americans were screened at TSA checkpoints this weekend. Nearly 48 million are expected to drive somewhere for the holiday. All this as COVID-19 infections soar to an all-time high, averaging more than 170,000 per day. Health officials are concerned this week's gatherings will intensify the surge. Meanwhile, news of a third promising coronavirus vaccine brings hope that the end of the pandemic could be in sight. Large-scale trials show AstraZeneca and Oxford University's vaccine is more than 70% effective, and that number could jump as high as 90% after some changes. According to researchers, the vaccine is safe for all ages with mild side effects. They say it's also cheaper to produce and faster to roll out once it receives regulatory approval.